Good evening, I'm Alexandra Meacham. Dan and Jackie have the night off. In tonight's top story, Mayor Adrian Perkins is defending proposed changes to the city's health care coverage. It's set to leave employees who use Willis-Knighton in a tough position. But did the city really take all the necessary steps to consider all the options? As NBC6's Shirley Busico reports, Willis-Knighton says they never got a chance to make their pitch.
We can't continue to pay millions and millions year in and year out with the rising healthcare costs. We have to make sure we're being fiscally responsible. We're finding the absolute best deals that the city can afford and that city employees can afford.
Shreveport Mayor Adrian Perkins continues to defend changes to the city's health coverage that critics say limits choices for employees and retirees.
These lower cost providers in Tier 1 would see slightly lower costs for themselves and their families. If employees go to other healthcare networks or their network of choice, for example, Willis-Knighton, there would be no increased costs to those employees.
With Willis-Knighton having 4 emergency rooms in the Shreveport-Bossier area, the chances of somebody being taken to a Willis-Knighton emergency room is very probable. So to say that a city employee or retiree wouldn't have increased costs for choosing Tier 2, in our minds, is just not correct.
Willis-Knighton President and CEO Jeff Fielder says they were never given the opportunity to present a formal proposal for an option that he says would save both the city and its employees money.
We did not. As a matter of fact, at the Healthcare Trust Fund Board meeting, we actually had the president of Aetna come and speak at that Trust Fund Board meeting, and she too said that Willis-Knighton nor Aetna had received a formal RFP in this matter.
Instead, the city's Healthcare Trust Fund Board reviewed a market analysis conducted by a consulting firm hired by the city and voted to move forward with a tiered plan with Blue Cross Blue Shield of Louisiana.
Blue Cross Blue Shield plan was $1.6 million cheaper than the Aetna plan. Well, if you're not in a formal RFP process where both organizations are given the same amount of information, how do you know that you've got a cheaper plan? How do you know that you've had a competitive process and you're saving the city the most amount of money and that the employees and retirees are getting the best deal?
Fielder says Willis-Knighton would still be willing to submit a formal proposal if the mayor's office is willing to consider it.
Because we want to make sure that city employees and retirees and their family members have the opportunity to come to Willis-Knighton facilities and see Willis-Knighton physicians without any type of financial disincentive.
Shirley Busico, NBC6 News.